Hey everyone, I'm Sebastian. I'm going to share a case presentation today of a person that we had come in with pain right around here, but also moved up into this area a little bit, kind of above the belt line. I will share some of the findings that we had in that scenario, but also some of the implementations and observations that we had too. So stick around for the whole video. You're going to be impressed. Again, I'm Sebastian at Performance-Based Sports Care, part of locally world-famous chiropractors in Costa Mesa, California. This was a really nice case because I think he had some great observations about what was going on with him. This person is a very active person. They're about 60 years old. They had pain right up into this area right here that was increased mainly with running and things like cycling too. The running was the biggest trigger, and the interesting thing was that he's been very generally active for a long time. But he also had a big event that created a spike in his mileage. Like I want to say about probably 5 times the amount of mileage that he normally does. And he's been running for years. And so he noticed that after that event, he started to feel the situation, especially when he stopped running. But when it started to warm itself up a little bit, he was okay. But then he would stop. And then he would start again and it would come back again. And so he was kind of perplexed by the idea that, like, well, if it was a torn muscle, why would it keep loosening itself up? Like if it was actually torn, or if he was even concerned it was a hernia. He's like, if it was a hernia, I don't understand why movement would really help it. And so we did a little assessment with him, actually a good assessment with him, to screen out things of the lower back, the hip, the nervous system, as well as something like a sports hernia, which is an abdominal tear or fray, if you will, that a lot of people are concerned about that they have. He didn't have any signs and symptoms of the hernia necessarily. A hernia is different than a sports hernia, but there was no association with bowel bladder function, no association with eating times. There was nothing to physically observe. There was no like thing coming out where he's like, hey, you got to check this out. There was none of that stuff. He did have a little testicular tightness too, the way he would describe it. He didn't say it felt like it really hurt. It felt like kind of a heaviness too. And so the assessment we did with him ruled out things of the hip, and it also ruled out things of the spine. But more importantly, it's figuring out like the things that actually bothered him. He actually had trouble figuring out what bothered him because he said, well, it's kind of just related to increase in running. Like, I feel like I was running and I stopped running as much, and I don't see any reason why I should do as much mileage as I did because I don't need to do the event anymore. And things are generally getting better, but he's here to check things out, make sure they don't get worse. Usually with a hip assessment, we check out first, does this bother him? Is there any actual obstruction of range of motion of the hip with going in and out all the way up? We check this one as well. And we usually check to see if they can actually circle their hip out too. All these are typically passive tests. Also, we usually flip them over to see if hip extension is available. On the side of the symptom, actually, he did not have a lot of hip extension availability. It felt like he really couldn't get his knee up off the floor. While the other side, he can get his knee up off the floor like that. This side was kind of stuck to the floor. So that insinuates there's something of the hip that's probably not painful, since when we evaluated hip extension and all the hip too, there was no labral tears, there was no hip flexor syndrome, there was no tendinopathy, there was no like hip arthritis. It was just a limitation of movement, and it didn't trigger his problem, meaning it was probably something that was kind of deeply rooted in there, which doesn't hurt, but also contributes to how load is shared amongst the body as he's doing things like running. So that was number one. His back exam was actually pretty normal, but the funny thing is, he assessed his problem. The only thing he could really do to duplicate his problem was to sit up. Like when he was on the table and we were done with doing a test, he would sit up and he's like, "Ooh, okay, I feel it right there." And so we went back to that test a few times just to see, well, do you feel it again? So normally at Performance Place, we do what we call an audit process. We have you do a movement that bothers it, that you can duplicate, that is every single time. Not like, well, I can kind of feel it. Like we want to make sure that you feel confident that you actually feel your problem during that scenario, during that movement. After that, we do an intervention take a minute or two, and then we do that movement again. And so we did one intervention with him, which actually proved to be very fruitful. And I love to say this it can be super complex why this may work, but at the same time, I always like to say just do the things that feel good. And so it hurt to round his spine and flex his hips. So instead, we extended his hips and extended his back into something called a press up. And so we had him do about 20 press ups. He said it felt kind of tight in his back, but that was about it. It felt like his hip flexor was a little bit stretchy, but that was about it. And afterwards, he flipped over and sat up again. He's like, huh, it's gone. So what does that mean? Well, it means that he has something else going on other than just hip stuff, okay? It wasn't a hernia. It wasn't a sports hernia. And we did the assessment of sports hernia, which is Davison's test. Now, he did have adductor tightness and tenderness a little bit too, but generally that's everybody with hip pain is going to have that. So we figured out that a lot of his symptoms was coming from what we call a flexion intolerant back and a flexion intolerant hip. And so we just extended both of them and he started to feel better. Now, where should we go from here? Well, there's other exercises to do to make this active. Generally, this is like a passive version of low back and hip extension. Passive meaning you're not really putting effort into it. I know your arms are, but the rest of you is not. And so we have to make it active. So what that may look like is some form of maybe a split squat. It might turn into sprinting, landmine work, some form of strength conditioning, even banded bridges, single leg bridges, things like that. All of it can really help. But really it comes down to figuring out the right thing for you to do right now to make it so your symptoms feel better. And it's not provoked during the exercises. And we have a lot of videos on YouTube, if you've seen them already, where it says clamshells hurt. Try it this way. Because we see a lot of people who come into our facility who have pain and discomfort and increased symptoms with the exercise they've been suggested, and they don't understand why. Typically, it's not the exercise, it's how you're doing it. You have to be coached. You can't just pick up an exercise all the time and succeed at it. Some can, but some don't. And the more complex your scenario is, the more coaching you may need for someone like us. And so let us pick the recipe, let us pick the exercise, and let us show you how to coach it. Okay? We have a lot of other free videos on YouTube about hips, groins, testicular tightness, and so on. We see a bunch of them in our office. I dare to say we specialize because we see multiple people a week with those types of symptoms. It's a lot of them, a lot more than a lot of other facilities do. If you guys are looking for really good information that's more curated, we have a webinar. It's going to pop up in one of the corners. The webinar is something that me and Dawn put together because we get so many questions about hip, groin, stuff into this region here, that we want to make sure that it's more of a structured answer. We do invite questions and comments below the video, but at the same time, I mean, there's a lot to learn, and we'd love you guys to learn. The best way that we see that you probably can is in about a 20-minute webinar format. It's free. Just take advantage of it. You have questions afterwards, you can reach out to us, and we'd love to help you out if we can. We offer virtual and in-person services, and as you can see, we do stuff virtually on camera. It tends to work pretty well if we can see you moving around. So subscribe to the channel. We'll see you guys next time.